I'm really excited to be in this room, the first full day of the Skoll World Forum. Raise your hand if you have had something that's inspired you in the last 24 hours. Yeah, that looks about right. I am Nicola Reindorp. My deep honour is to serve as the CEO of Crisis Action, which uses a pioneering model of harnessing the power of coalitions to influence decisions in war and peace and protect civilians from conflict. I'm really grateful for this opportunity from Skoll to share today this platform with you, to moderate a conversation with incredible change makers. I have to my left Angela Gichaga from Financing from Health, Drew Kodjak from the International Council on Clean Transportation, and Rebecca Onie and Rocco Perla from the Health Initiative. Sadly, you saw, I think, on the earlier materials that Gichaga was due to be with us from Living Landscapes, and he can't join us as he has had a bereavement in his family. So our thoughts are with Jagdish. But I do have Rebecca and Rocco and Drew and Angela with me. I'm going to ask them to share more of themselves with you and their incredible work in a moment, and what it teaches us about the possibilities of transformational change. But before I do, I just want to touch on what brings the five of us together. Health, transport, protecting civilians from conflict. At first blush, different challenges. But what do we share? We are what the Skoll Foundation is calling systems orchestrators, or what Bridgespan are calling field catalysts, or sometimes system catalysts, or some mix of those. It can be a bit of a mouthful. And I think there's a risk that we lose ourselves in the jargon. So before we dive into the detail, I hope you'll permit me just to draw out on some of the definitional elements of what is underpinning this, to avoid confusion, maybe calm some nerves. So Skoll describes us as backbone organisations that drive coordinated, collective action across a whole field of actors and sectors, all aimed at achieving the desired systems change. So just thinking about that, what to draw out here. First is the nature of the problem, of how we look at the problem that we are trying to grapple with. And so that is that the changes that we are seeking for the people and planet that we live on are all underpinned by multiple factors. They're complex, they're hard. It's features of a system, of mindsets, of behaviours, of institutions, of policies and practices, and that we want to focus on disrupting and altering that mix of action and mindset that sustain ill health, that ensure climate damaging transport options, and inflict appalling horrors on conflicts, civilians caught in conflict. So it's how we think about the problem. But the second is the nature of the solution. And that is that change is bigger than any one of us. It requires collaboration and the creation of partnerships to challenge and disrupt those systems. It involves companies, governments, civil society in all our glorious array, from faith leaders to artists, business people, social movements. That it requires breaking down silos, building networks, drawing together allies, aligning on our common goal, and forging coordinated strategies to deploy multiple tactics. Think of Don Gipp's description, for those of you who heard of the orchestra conductor that has perhaps also composed the score, or the coach that has designed the specific play for success. So underneath those labels of field catalysts and system orchestrators and strategic conveners, it's holding on to whatever we call ourselves. I want you to think about this as you listen to us all, that it is, rather than mitigating symptoms, it's tackling causes or root causes. It's a focus on savvy strategy and choice, spotting the interventions that will be catalytic, and ensuring that impactful energy and efforts are directed where they will have greatest effort. It's a recognition that impact requires action that no one organisation can achieve alone, and therefore the imperative to collaborate. As we heard Christina Figueres say in the video at the opening plenary yesterday, when she talked about tackling the problems of tomorrow, you should remember she was the chair of the climate talks a few years back. It requires that we are savvy, smart and collaborative. It's a way of thinking and working that offers lessons, I think, for those that are interested in change, those that want to see and invest in opportunities to have impact at a scale that we have not yet cracked, and to be able to share learning. I am enormously proud that Crisis Action is among this group and to be recognised for our pioneering model of impactful change at scale, disrupting the systems that sustain conflict and spurring new norms and behaviours and institutions to protect people at risk. We were founded in the wake of the Iraq War by a man, a Brit, called Guy Hughes, who saw 1 million people on the streets in Britain, and still the then Prime Minister, Tony Blair, went to war. And his conclusion was, surely we have to be smarter as civil society to influence decisions on war and peace. That core assumption, even war, is not inevitable. It is possible to change the incentives and systems that spur and sustain conflict. And so Crisis Action was born with this idea: we're driven by a model of equity, that no one, no civilian, wherever you are, should get caught up in conflict, that no one's child should spend the night not knowing when the bomb is going to drop, that no one should be having to think whether they're fetching water or going to work, whether they're going to their fields or they're going to pick up bread, of whether they will lose their life en route. Guy Hughes forged a model of strategic convening, where it was collaboration with someone's day job, harnessing the strengths of many humanitarian, human rights and conflict prevention organisations, operating in silos and instead drawing them in as partners into a shared effort to focus on what's the problem of what's causing conflict in different places, what can be done about it. Sudan, Syria, Yemen, Ukraine, that is the place where Crisis Action operates. We listen to those directly affected by conflict or its threat for their views and vision. We triangulate with those inside government or companies about what is it that could move the needle, that could shift the dial, that could create a change. And then we offer a proposal back to our partners to say, this is what we could help you do to work together. Are you in? And in that way, avoid the lowest common denominator of waiting for everybody to agree and focus only on the impact that that coalition can have together that no one member could have alone. We have no money to offer, we don't have funding. It is the joy, the conviction of by working together, we can have more impact. Thanks to that work, women have got to get a seat at the peace table in South Sudan, again, affecting millions of people. It's a fragile peace, but it's holding. We have halted arms sales, for example, US arms sales to Yemen, where Yemen now has the best chance of peace that it has had in a decade. We've seen peacekeepers deployed to deter violence and protect people and to enable incredible faith leaders and community leaders to try and knit their communities back together. Those guilty of war crimes have been held to account, and new ways of detecting and punishing and deterring crime is being pursued. We helped get Russia kicked off the UN Human Rights Council at the United Nations because conflict is more likely and lethal when women aren't at the peace table, when norms aren't upheld, where there's no price for committing crimes. So we are trying to unlock those systems. And we're incredibly grateful that Skoll has distilled that model, recognised the power of that collective convening model that we have, and distilled it into a handbook that's available at www.crisisaction.org. So you can pick it up, that model, and we have spurred 2 sister organisations. One is led by a guy, but I claim him as a sister. So that's Climate Catalyst, operating in the climate space, and Digital Action, looking at digital threats to democracy, using that same strategic convening, system orchestrating role Collaboration is someone's day job, opt-in, behind the scenes, focus on impact, no brand or profile. It is a tiny organisation, and this is true of all of us, unlocking change at a scale far in excess of our size because of the change that we catalyse in coalitions and the way that we work. And this is what I know you are going to hear really inspirational stories from my colleagues here, and that we want to share with you, to learn with you, to hear perspectives and answer questions. So we'll have a chance to hear from them, and then I really hope you'll participate in this conversation so you go away with a sense of clarity and no fear about this terminology that's kicking around, but actually really inspired about the possibilities that these models and opportunities present. So, without any further ado, let me turn, Angela, tell us about, for Financing for Health, what's the system that you're trying to tackle and how do you go about doing it?
Great. Thank you so much, and thanks everyone for making the time to have this conversation, and we're looking forward to learning from each other. The Financing Alliance for Health is a system orchestrator, field catalyst, and all the other branding that is coming to us because of who we serve and how we serve. So who we serve governments. We exclusively serve Ministries of Health and Finance, who we already know are at scale and work towards sustainability. We serve governments, and we serve not just line ministries, we serve multiple ministries to entrench sustainability in the work that is done. The Financing Alliance for Health is a field catalyst because by engaging the stewards of the system, and specifically the public health system, who have the mandate over the populations within their country, we're able to put the right policy environment and the right budget environment within a country that then influences the mandate, the initiatives, and the programmatic implementation of everyone else within that space. We are a system orchestrator because we are reorienting health systems, but not reorienting them just with a health systems lens, that the work we do affects, as Nicole said, it's not just about saying we work under this particular area, SDG 3. The work we do is cross-cutting. It has an economic impact, it has social impact, it has, it creates jobs for people, it's able to create livelihoods as well, and it's able to also avert deaths. We are a system orchestrator as well because when we work by embedding members of the team within the ministries, and our members of the team supporting the ministries are able to engage other partners. So again, Nicole said, as a system orchestrator, it's not just about my logo, my ego, my organization, and what we are directly able to do. It's about how do we play that neutral facilitator? How do we act as that bridge between the person who we serve, who is the end user, through their government, to effectively engage other partners within the space? We work at scale, and meaning that with a small team, as you mentioned, we are able to catalyze and support multiple players, and we've been able to serve 17 governments across the continent as well. It's about collective action. It's about understanding, and I'll say this again later on, it's about recognizing that my outputs is someone else's inputs that then leads to other outputs, and we are okay with the comfort and discomfort of the contribution and the attribution we have with the work that we do. Yeah.
Thanks. Drew. Yeah. Yep. Definitely applause. Welcome applause. Drew.
Great to be here. My name is Drew Kodjak. I run an organization called the International Council on Clean Transportation. This year, about 24 million in budget, 140 staff in the major vehicle markets. So we have offices in DC, San Francisco, Berlin, Germany, Beijing, China, Sao Paulo, Brazil, and New Delhi, India. Our mission is to decarbonize the global transportation sector by mid-century, consistent with the Paris Climate Accord. Not a small goal for anyone, right? Massive system change will need to happen in order to accomplish that goal. I'm going to tell you a story that dates back to 2012. And before I tell you the story, let me ask you all a question. Who here in this room has heard about the Volkswagen scandal when they were cheating on their emissions? Just raise their hand. Okay, right. That's delighted to see that. Delighted to see that. So way back in 2012, we were a much smaller organization. We had some funding left over at the end of the year. And I asked for a proposal, and we got a proposal from the European office that they wanted to use a new system to test diesel cars in the United States with what we call portable emissions monitors, or a miniaturized lab that you put in the trunk. The hypothesis was that diesel cars in the United States would be clean even under what we call normal conditions or real-world driving conditions. The problem that they were trying to solve is that in Europe, there was data suggesting that wasn't the case, but they couldn't get any governments to pay attention. So the idea was, we know California does a good job, we know the United States does a good job. We'll test the vehicles, they'll be clean in the US, we'll take those results to Europe and say, look, you can do it here in Europe. So things didn't work out that way. So just by happenstance, there's not a lot of diesel cars in the United States, less than 0.5% of the fleet. We tested a Volkswagen Jetta diesel. We tested a BMW X5, and we chose the Volkswagen Passat because the model in the US is almost identical to the model in Europe. We worked with West Virginia University, and we worked with the California Air Resources Board, a little bit of partnership there. Right. We tested the vehicles under lab conditions where they're put on dynamometers, on rollers, and they're tested under certain temperature conditions, et cetera. All the vehicles performed very well. Then we tested them under real-world driving conditions. The BMW did really well. The Volkswagens, both of them, had between 25 and 40 times the emissions. Right. So just so high we thought we must be doing something wrong, is that it turned out we weren't. So we published that report in the spring of 2014. And I sent a very nice email to my friend over at Volkswagen saying, hey, we're not going to extrapolate results from 2 vehicles to your entire fleet, but you may want to look into this. Same thing with a good friend of mine. I used to work at the US EPA, so the head of enforcement there. And CARB, and California Air Resources Board. And California had these discussions with Volkswagen. They said, Volkswagen, what's going on? And Volkswagen, for a year, kind of didn't really come clean. And in fact, Volkswagen said, oh, we'll do a voluntary recall and fix it, no worries, and Volkswagen did, and California said, we'd like to just test, just to make sure that it's all worked out now. And the tested vehicles that were supposedly clean really weren't. Right. So in August of 2015, the head of enforcement for the Office of Transportation and Air Quality, EPA, told Volkswagen, I'm not going to allow you to sell vehicles in the United States next year until you get to the bottom of what's going on with your car. Now, when I tell this story throughout the world, no one believes that that's the case. No one believes that a relatively middle-level bureaucrat named Byron Bunker had the authority to tell what was at the time the world's first or second largest vehicle manufacturer, I won't let you sell vehicles in the United States anymore. But that's the way the system works in the US. There's a lot of delegation of authority, which I think is generally a good thing. So Volkswagen eventually came forward and confessed that there had been what we call defeat devices on all of their diesel cars that they'd been selling in the United States since 2009, right, all the way up to 2015. About roughly 500,000 vehicles in total across all of their brands. So so it's Volkswagens, it's Audis, it's Porsches. Right? Significant air pollution because of that. Right? There was a big announcement in September of 2015, and the ICCT, my organization, was named as the organization that did the original testing that launched all of this. That led to more than 18 billion in penalties and changes really around the world in terms of how countries do compliance and enforcement in motor vehicle emission standards, number one. So massive systems change. And number two, Volkswagen, to their credit, use that as a way of being introspective about, well, what has happened to our culture to allow this to happen, and what do we need to do to change that? And to their credit, Volkswagen really did do 180 and decided, well, we're going to clean everything up, and we're going to go into electric vehicles much faster than most of the other legacy manufacturers, right? So that's to their credit as well. And so that's my story, just to start off and give you something very, very concrete to understand. I'm happy to tell more about how we do our work. That actually is not how we typically do our work, right? We don't typically stumble upon massive fraud. That we don't use that as a tool typically, but it did work in this particular instance.
We'll come back onto that piece about the interaction around the particular levers and strategic interventions. Yeah. For this moment, I'm thinking, where was Drew when I needed him when we bought the Jetta in Hoboken, New Jersey, thinking it was the environmental car of the year.
Yes,
so
yes.
I'm so glad I know you now, but my Lord, I needed you 10 years ago. Rebecca and Rocco, the Health Initiative. Yeah. Talk about the system that you're trying to change and how you're doing it.
Yeah, and thank you so much for having us. I think it gives us hope that there's so many people in this room. So 25 years ago, I launched and then with Rocco led Health Leads, enabling physicians across the United States to ask their patients, what do you need to be healthy? And then prescribe those things. So fruits and vegetables, heat in the winter, electricity to refrigerate their medicine, and then we navigated patients to those resources. We got the Skoll Award in 2011 and worked our butts off and quintupled the number of families we served to reach about 13,000 a year. But in the United States, there's 38 million Americans who struggle with the basics. And we just had that sinking recognition that I'm sure so many folks have had that we were never gonna scale to that number or anywhere close to that. And it became really clear that we had to move from outside to inside the healthcare system and launch the Health Initiative, again, with support from Skoll.
So unlike Rebecca, I come from inside the system we're trying to change. Before I joined Health Leads, I helped lead the US government's new $10 billion Healthcare Innovation Center. And while we began to fix healthcare, we really struggled to address the realities of patients' lives. We talked about medical homes, a way to coordinate a patient's healthcare, but we never thought to ask if a patient had an actual home. And so it's this dual perspective that Rebecca and I bring from across health and healthcare, outside and inside of the system, that helped us see the path forward. To guide us on that journey, we hired a leading Republican and Democratic polling firm to ask voters across the country, if you had $100 to buy health in your communities, how would you spend it? And you can see the results here. Across race, gender, geography, politics, the voters agreed, spending about 1/3 on traditional health care, hospitals and clinics, and 2/3 on access to healthy food, housing, transportation, and childcare. But the problem is that is not how we spend our money as a country. The annual healthcare spending by the government and private insurance companies in the US dwarfs everything else in the federal budget: agriculture, housing, education, transportation. And because what we pay for is the ultimate expression of both what and who we value, there is no inclusive economy or health equity absent increased investments in health. It was those voters that gave us our mandate and our vision, which is a health-based economy. That's a commitment to invest our nation's resources equitably in health, not just healthcare. THI works with organizations that control billions of dollars and impact millions of lives every year to spur them to increase investments in food, housing, decent paying jobs. And we've worked with hundreds of stakeholders, many who've historically been excluded from health policymaking in the United States, to put incredible pressure on status quo actors to do exactly the same thing.
There's a fascinating theme that's already coming out, and again, this sense of the insider-outsider, and also different forms of data, whether that's the real stories and experiences of what those affected by these systems actually want and need, and to what extent the institutions that are propping up those systems are listening to or driven by. Coming back a little bit, so thinking about to draw out for you, how do you think, Angela, this process for you of Financing for Health is uniquely helping you achieve change at scale? What are the pieces about the scale bit that resonate?
So we think about a government in a country. The government has a mandate and a responsibility to its populace. and the populace is a large group of people. And how the government actually achieves that mandate is, one, by putting the policies in place and setting the priorities that then drive investments within that country. Those same policies actually regulate what everyone else in that country is able to do and then is mandated to do. The government as well has a huge human resource available to it that is spread across the entire country. You know, we have many organizations and corporations that operate in our country, but if you ask them, how many employees do you have? In many of our countries, the civil service is actually the part of the largest organization and human resource available within that country. And those are human resources that can be leveraged to advance information and services to the populace. The third is that many people don't like thinking about it, but let me ask you a question. In the country you come from, who has more money in that country than the government? Private sector? I am not about vices like betting, but who wants? Are you sure the private sector has more money than the government?
Private individuals.
Oh, a billionaire.
Yeah.
So the number one billionaire in the world has more money than the entire government that he comes from?
No, you're right.
I raise this point because many of the times we talk about, we want to talk to, we talk about investments and we look at individuals. We look at the private sector. We look at ourselves as out-of-pocket spenders. But the truth is, majority of the time, in most countries, the person, and I'm counting the government as a person, the person who is sitting on the most resources in that country is the government. Now, we can have a debate until the cows come home about how they use their money, is it effective, and allocation. But the truth is, yes, they do have conflicting priorities, but they have the ability to not only mobilize their own resources behind a priority, but because of the balance sheet that they sit on, they're able to catalyze additional investments and different types of money to accompany the money that they themselves are putting into the system. We need to recognize that. It's not just about the private sector, and the private sector has its role, but there are few individuals or corporations that sit on a balance sheet comparable to the Ministry of Finance or Treasury in that country. We need to recognize that. How are we leveraging those resources? How are we leveraging those dollars as well? That is scale. The amount of money that this person or player can bring to the table to set the agenda and influence how that agenda is implemented within the country. The government also has a huge convening power, a huge coordinating power. I mean, Skoll is giving the government a run for its money, but a huge convening and coordinating power within a country to be able to call different types of stakeholders together and request them to share their resources and plan together. So when you ask, how is the work that we do at scale? It's because the government is at scale, money-wise, people-wise, mandate-wise, influence-wise. We work with the person who is already at scale to then tap into and unlock the ability to lead a pathway to sustainability.
Thanks. Drew, what does this look like, the answer to the question for you and from the International Council on Clean Transportation, what about how you're working that is about scale?
Right, well, I'm going to just go right off what Angela was just saying. We work with governments, and not so much on the financing side, but on the policy side. So I'll give you a sense. If I just look at the regulations, so we work on 3 types of regulations, right? And by the way, who knows what a regulation is in the room? It's pretty obscure. It's relatively obscure. I mean, that's pretty good. I think 3 people, right? Maybe 4. So everyone knows what a law is, passed by Congress, signed by the president. Everyone knows what an executive order is, signed by the president, can be undone by the next president, right? Relatively modest, short term. And then in the middle there are regulations, and regulations have the force of law, but they are typically only implementing, right? So Congress says, let's require manufacturers to reduce emissions by X, and the regulations will design to be, well, what are the processes and procedures by which the manufacturers will demonstrate? Right? In our field, though, in this field of clean transportation, the regulators have the authority to set the standards as well. And because of that, and because data is so critical to be able to do those standards, the ICCT, my organization, is able to work with governments in the US, in China, in Europe, in India, in Brazil, in Mexico, all throughout the world, and get them the data that they need in order to be effective in establishing those regulations which have the power of law. Just yesterday, the US EPA issued a regulation which will require 2/3 of the passenger vehicles sold in the United States in 2032, less than 10 years from now, to be electric. Right? That was not a law. It was based on a law. Right? Clean Air Act gave EPA the authority, but it's now a regulation. So that is the type of policy that we work on throughout the entire world. Right? And so to give you a sense, to tell you another story very quickly, way back in 2008, when I was just starting the ICCT, we were working in European CO2 standards. And we had a big loss. Right? We often don't talk about our losses, but I think we should talk about it. We've got beat. Right? The standards got rolled back by about 20% and delayed from 2012 to 2015. The saving grace was that Parliament put an indicative target into the standards, 95 gram per kilometer CO2 in 2020. And at the time, industry laughed and said, we're never going to meet that standard. Too hard, too difficult, et cetera. But there was a technology review in 2013, and I spent the next 5 years making sure that we had enough data and analysis and support that that standard would get locked in place. The industry called it a tsunami of data. And those standards were supported and finalized at that level. Little beknownst to us, we didn't anticipate that electric vehicles and the cost of batteries would come down precipitously between 2013 and 2020, but they did. And so because of those regulations, European electric vehicle sales rose from 4% in 2019 to 11% in 2020 to 17% in 2020 and 2021, and now hovering just under 20% these days. Right? A staggering amount of progress in a relatively short period of time, driven largely by government regulations. China is also around that. The US, as you've just heard, is now going to catapult forward. Those three markets are roughly 60% of passenger vehicles sold in the marketplace. All of that, and here I'm going to go off the climate script. The climate script is doom and gloom, right? We have no hope. I can tell you that we can see a pathway by which the global transportation sector, and mainly light duty and heavy duty, but maybe marine and aviation as well, can get below 2 degrees of warming. Right? We can be on that track. Right? And I could never have said that 4 years ago. And I think that's staggering, and I think that should give everyone in this room hope that if we do it in transportation, which, by the way, 5 years ago was seen as we're never going to be able to mitigate transportation, we really have to do everything else. And it's now leapfrogged. That should give everyone hope that if we can do it in transportation, we're not done yet. There's a lot more to do, right? But we can see a pathway, and I think that's exciting.
I hope we'll be able to unpack. I should have a whoop for that. I'm whooping. We'll unpack a little bit, alongside, perhaps in the conversation, sort of understanding underneath that data, that magic word you said, and that it had enough support. So the motivation, the incentive to actually pass the regulation of what is it that's that mix of the constituencies that need to back it, who needs to be saying what to whom. But Rebecca and Rocco, for you, the answer to that question about sort of impact at scale, what's significant about the way that you're working?
I mean, I'll just say, Angela, I love what you said because, folks in the systems change space always agonize about, how to measure impact. And I think our belief is that if you follow the money, you can get super clear on impact. So in the United States, we spend $12 billion every single day on healthcare. And the question is, what are we buying? And so our work at THI is really about how do we unlock that $12 billion a day to invest instead in health and economic well-being for people and communities. And so, and I think to your point, Angela, it's like, how do we get that flywheel going between the private and public sectors so that it's mutually reinforcing and drives mutual accountability? We've worked intensively with the leadership of a Fortune 25 health insurance company in the US, getting them to really listen deeply to what their own employees said they needed to be healthy, and then designed the first ever health plan that actually pays for childcare, food, or transportation as part of the health plan, with massive reductions in food insecurity, healthcare utilization, and healthcare costs for those employees. And then with that evidence that investing in health is not just the right thing to do, but also the economic thing to do, the company then increased wages, the ultimate driver of health, by $58.5 million a year for their low-wage workers, 80% of whom are women, and primarily women of color. On the public side, we also, at the same time, orchestrated a campaign with hundreds of stakeholders, resulting in the US government requiring for the first time, thanks to regulation, requiring for the first time that all hospitals in the country ask 33 million patients a year whether they're struggling with food, housing, transportation, utilities, or interpersonal safety, and then spurring those institutions to then act to ensure that people and families have the resources they need to be healthy.
Again, part of that answer at listening to the employees, of finding a constituency that matters to your target. I think you're hearing great and savvy strategy. A question that I didn't warn you about will come back, but I mean, again, this represents about choices, something we have in crisis action. We have 5 criteria to decide where we work. It's the most, I think, strategically significant and emotionally brutal part of what we do. And so I'm just warning you, I might come back to ask you a little bit about tough choices, but more broadly, core challenges you have in your work, whether it's the tough choices or other things. Angela.
One, and this is so relevant as well to the health initiative, this idea that health is a cost, and the idea that health is just a morally good thing to do, right? One, health is an investment. Health is an investment in us. Health is an investment that has an economic return through GDP, through aversion of your debts, through making you healthy, that you can be productive. Health is an investment because it creates jobs. Health is an investment because it helps us actually be able to do everything else. And if the pandemic did not teach you anything, please, may it have taught you this one lesson, that health is a valuable asset that we have, that we need to protect and we need to invest in. I think that's the first challenge. People want to have roads and infrastructure, impact and investment that we can touch, see, and feel. But they are actual investments that are equally, if not more valuable, that we cannot necessarily touch, see, and feel until they are absent. And health is one of them. Let's not look at the social sector with the lens of this is morally correct. Let's look at it that it is a right and it is a true investment. The second is that the government does nothing. The truth is there's a lot of challenges within the system as a whole, but also that face the governments. But governments are stepping up. Governments are co-contributing. Governments are setting agendas. They are giving the regulations that then help folks like Drew and others catch people when they're off, when they're not doing the right things, right? So this misconception that governments don't do anything, or it's only one stakeholder who will wear the cape and save us all from what is impending. No, it is not a solo act. It is a play. We all get the script. It's our role to play our part well. The third challenge I have is that as we think about system orchestrators, field catalysts, comma, and every other title that we're given, there is this idea that, okay, the way we have invested our time, our money, and our people when we're doing direct implementation is exactly the same thing we cut, copy, paste, and invest to system orchestrators. We want to use the same templates, we want to use the same metrics, we want to use the same restricted, limited dollars to invest in the same way, but then get exponential impact. And I'm here to challenge that, right? If you ask all of us, thank you. If you ask all of us the impact that we're able to measure, had we anticipated at the very beginning, that's what we were going to, no. And this thing around, I'm not just directly training someone to deliver a service that I can end-to-end track, right? I am putting something into a system. There is commitment I can give around what I can say is directly attributable to what we do. But he will make a regulation that will have a health impact. He's tracking what's happening in transport, right? But somehow his regulation is now affecting how health operates and how other sectors operate. But then we want to be like, no, I want to give you money, limited amounts, let me restrict it. At the end of the year, I want to know what your impact is. What have you done at the end of the year? Yet we are actually reorienting systems, right? I am not saying that they are completely different, but I am saying that if we want to have exponential change, we need to be willing to cede control. Cede control on how we are putting the money into the system, cede control on what we are able to control within the system, and cede control on the results at the end. And they are mistakes. We make models, and then life happens, and we don't get the results we wanted, right? And are we open to give that flexibility for things to work and work beyond our expectations, or actually to fail spectacularly? And that is the reality and the range and spectrum that exists. It's not unique to field catalysts, it's also there for implementers, but it's exponentially increased for field catalysts because our impact is also exponentially higher. So I would love to challenge this misconception that we can do the same things exactly the way we've been doing for direct implementers and just take that and put it through system catalysts. It's going to be a challenge.
Drew, your take?
There was a lot of truth there. So what are the challenges? I'm going to name challenges. I'm also, I think, finally going to get to your question about systems orchestrators. So one challenge we have is time. Right. I think at this point, electric vehicles are actually a superior product when you get down to it. They're going to be cheaper, they're going to be funner to drive, they're going to be lower maintenance, they're going to be lower cost. So they will eventually replace the internal combustion vehicle. The question is, will they do it fast enough, right? So that's the game right now. Can we decarbonize? Can we get electric vehicle for passenger vehicles? Can we flip out all sales by 2035? Heavy duty by 2040 or sooner. That's where the challenge is, and then can you really have interim targets all along the way? That's the challenge. We need government to have a vision, to put out a vision to say this is when we want to decarbonize. We've heard that in many governments, but not all of them. Incredibly helpful in aligning, and here's where I get to system orchestrators, right? So we're in the UK. The UK actually has established a proposal that would have 80% of passenger vehicles sold in the UK in 2030 be 80%. That is, if finalized, the global high water mark. Incredibly powerful because now the OEMs, the automakers, know what they need to produce. Right? The fleets know what they need to buy. The NGOs need to know what they need to support. Philanthropy knows what the alignment is. The charging, the folks that put in the charging infrastructure knows what they do. So do the utilities, right? There is a huge amount of system change when you're changing over 100 plus years of fossil fuel transportation into electric in 10 years, right? And so a massive amount of orchestration has to be done, and that's where system orchestration comes in a huge way. One of the ways that we're trying to contribute is we host a transatlantic transportation decarbonization summit, very large title. We did the first one last year. We're doing another one this year in Germany. Last year it was just outside of DC, where we invite all of the players together. that don't ever really get a chance to talk amongst each other, what we call progressive thought leaders, to be able to align and then continue to align as we go. But it's a huge challenge. It's an incredibly important challenge, and it's a great one to talk about. So.
Rocco, Rebecca, challenges.
I mean, I'll say the first challenge, and just hit me as we were talking this afternoon, is when Drew asked how many folks could define regulation or no regulation, and 3 hands went up. As an inside the system person, I actually think that's a liability. When this community and the folks who are represented here are working actively with folks who understand the regulation, I mean, that's basically our partnership. Is I'm coming up with regulatory soft spots, and Rebecca's saying that actually isn't going to impact anybody. It's not a meaningful change, but I'm like, well, it's something we could do. So there's this pressure testing around what actually matters. And so I think there's just something about building that cadre of sort of collaboration around the regulators and innovators and change makers. But I'll say the one key challenge for us to unlock healthcare dollars is that THI has to operate largely behind the scenes. That means ghostwriting op-eds, stakeholder public comments on proposed policy changes, speeches and articles for sector leaders, scripts for company investor calls. For example, in the US, to get the government to require hospitals to ask all their patients if they're struggling with food and housing, THI ran a campaign in which 40% of the public comment letters submitted came through our direct engagement with stakeholders. And it also means identifying and supporting others to lead. In that work, we collaborated with a network of over 1,000 community-controlled clinics that eventually ended up running the second half of the campaign because they were best positioned to do so. But THI's low visibility has created a real challenge with funders. There isn't a New York Times article or op-ed or podcast about our work, and that is essential in order for us to maintain this trusted advisor status that we have and to build the kinds of relationships that we need inside and outside of the system. And that is exactly why we need unrestricted, multi-year philanthropic resources for systems change work. I mean, to be blunt about it, the US government is not about to pay us to disrupt itself, and we can't accept public funding because of the massive risks around conflict of interest given the enormous amount of money that's moving through the healthcare system. And so philanthropy is what enables us to maintain that honest broker status and to leverage coalitions to drive change inside and outside of the system. And I think Skoll is a great example of that. So together, we hold very tightly onto our goal, our aim of increasing investments in health, but we hold loosely, Angela, to your point, in terms of the ways in which we're going to achieve that. For example, when Skoll reinvested flexible capital in THI, we had no way of knowing that the next regulatory window was right around the corner. But they trusted that if it did open, we'd be able to seize it. 2 years later, 3,000 hospitals will be asking anywhere up to 33 million patients every year, what do you need to be healthy at the most basic level? And it's not just the money and the resources, it's also Skoll's openness to roll up their sleeves and dig into the work with us by connecting us to other portfolio organizations that themselves submitted public comment letters, helping us identify and strategize ways to engage senior policymakers, and candidly gapping a lot of the blind spots that we have as an organization.
So colleagues, on that, I think it's a great moment to throw the conversation out to those in this room. Reflections, questions, things that you want to share. Gentleman in the back. And Stephen here.
Thanks,
number
Nicola.
3 and number 4.
Hi,
Lovely.
Rebecca. I'm Sasha Chenoff. I lead an organization called Refuge Point, which finds lasting solutions for refugees. The world just went over a tipping point. 100 million people are forcibly displaced. Estimates are that perhaps 1 billion people may be forcibly displaced by 2050. The physical and psychological harm and moral catastrophe as all this is immeasurable. I would say one of the key solutions is something that the world now recognizes, self-reliance. How do you support people to build their own lives, contribute to their communities in the countries to which they fled because people don't go home for 10, 20, or 30 years? we have built a multi-stakeholder initiative called the Refugee Self-Reliance Initiative, a little along the lines of what Willie Foote at Root Capital has done or Jordan Caslau with iLiance has done, to harness the global community together to build an evidence base of best practices and programmatic and philanthropic responses to enable refugee self-reliance. So it's a kind of systems change effort. And I guess the very simple question I have, Nicola, to you, and you've been a real inspiration, and others, is like 3 big lessons, quick lessons on how to build, how it's effective, what can you do to make this as effective as possible. Thanks so much for this panel. It took me a really long time to get in here because the room was full.
Welcome, Sasha. Let's gather a couple more. Stephen here, and then if we can have the microphone to the colleague just in front of Stephen.
Thank you very much. I'm Stephen from Climate Catalyst, an organisation that, as Nicola said right at the beginning, is very much inspired by the model of crisis action and adapting that model to a new challenge, a new area. So I just wanted to make 2 points, which I think a little bit pick up what you just said. The first is that I think we have to get beyond the notion that there's a kind of zero-sum game for all of us in this room, and the notion that either I get the funding and achieve the impact, or you get the funding and achieve the impact. Because if we don't have partners, we don't have system orchestrators. So I think that's something that we all have to work on as a community, and that funders have to help us do, to get the sense that all our boats need to rise up the beach, right? That we need to work together and not to see one another as competitors. And inevitably, funders can drive that competition explicitly or inadvertently. So I think we've really got to work on that and deepen our commitment as a community to work together. And the second thing I would say is that it's a huge challenge also to maximize the diversity of the partnerships we build. Because it's not just about people that receive grants from philanthropic organizations. It's also about people at the community level who are self-organizing. In our case, it's very much about working with the private sector, who have enormous power and influence and are sometimes aligned with what we're trying to achieve. So I think that diversity of partnership is really important.
Great. And you just pass forward, lovely.
Thank you. Hi, Andrea Nempton from Social Innovation Canada. And I really love the preventative action towards sort of unintended adversaries. But I'm reflecting on the fact that someone said to me once that systems will do exactly what they're designed to do. And I think when we're looking at the healthcare system or at any of these systems, the automobile system, there are going to be losers. When you start to shift the cost from healthcare and from the medical expenses into healthcare, there are going to be losers. Volkswagen was a loser. The change is going to cost some people. And how do you manage that? I think we don't really talk about the price that folks are going to have to pay. We pretend that there's going to be no impact other than good impact. And I'm not saying it's bad impact, but there is definitely impact where some are going to have to give up. I'm just curious about how you deal with that in your day-to-day.
So I'll put to the panel, not everybody has to answer every question. You can pick up which you like to choose. So I will turn to my esteemed colleagues. So I won't hog the limelight on Sasha's question, but if you want to offer around 3 lessons. The second about Stephen on we shouldn't be thinking about this as zero-sum game. And third, Andrea's question around how do you manage the fact that change brings losers?
I guess
Angela.
I agree with what has been said, and one of the biggest lessons, and tying to the question that was asked, is collaboration is the new competition. And if you think about it, that it's either you get it or we get the money, it's not going to work. A perfect example is what we do with the Africa Frontline First. One organization took a budget hit to create an idea that then now it has been able to mobilize and catalyze funding. We were able to engage Skoll Foundation and J&J to put $25 million into Global Fund. Their $25 million investment unlocked money within the Global Fund, and now we have a $100 million catalytic fund, right? That meant that one organization had to make the decision of, it's not just about what we want to achieve, but understanding the scale and the root causes of the problem is the financing and the type of financing and the mix of financing. Now, we can bring government money to the table, but there are other types of money we need to crowd in. But because of the kind of organization we are, we might not be in a position to be able to deliver on this. So we will take a budget hit, make a seed investment of our own and restricted and limited budget to come up with an idea that then we'll be able to fund multiple other players in the ecosystem. Are we willing to sacrifice, to the point that you raised, to be able to change the system, not only in our favor, but in the recognition that it might take us to sacrifice something for a greater good, for the long-term gain, right? And I think to the second point, and I'll let the rest answer, there are trade-offs. There are trade-offs, and we need to balance the short-term gains, the medium-term gains, and the long-term gains of the trade-offs. And these are very individualistic based on which stakeholder exists, right? So there are trade-offs for some of the work that we do, but we need to be aware of them and then be very conscious about how we discuss the trade-offs we are willing to make and able to make, and those that we are not willing and able to make.
Drew, you want to pick it up?
Sure, I'll be very quick. I love both the questions. On the, it's not a zero-sum game. It is incredibly true that it's very difficult to collaborate as NGOs because of funding. I think the way around that is through partnerships where you do joint proposals, right? That's been our best situation, where we find another NGO that we really want to work with, and we do a joint proposal to a foundation, and we get, and that's the best. So I would just sort of throw that out there, and it can be very effective. The question on what about the losers is not asked and not discussed enough. You know? And I could talk a long time about that, but I'll just say I think I would reframe it to say, what is the responsible thing for civil society, philanthropy, and government to do when you're looking at a climate crisis and the actions that we need to take? And I think the best thing you can do is be explicit and transparent about where we need to go to give the private sector enough lead time to adjust. Right? We are not, no one can manage to make sure that there's no winners and losers. That's not the case. But to give enough transparency and enough time to allow the private sector to make enough changes, I think that's the most responsible thing we can do. So that's how I would answer that. Very good question.
Rocco.
On the question of winners and losers, that quote around systems are perfectly designed to get the results they do is a really important one. Through quality improvement circles, I know it's been something that's often discussed. And I think it's important to note that I think one of the reasons why we're so intrigued with systems is that it's the most efficient way to mass produce justice or injustice. I mean, you can just do it, it's at scale, Angela, to your point. And I think the question I would have is, who's losing now? When Rebecca talked about our work in supporting that wage increase, 80% of that wage increase benefits women, and predominantly women of color. And so I think it is a really important question, because I think it gives us the context by which to understand how can we move the system forward to protect, to the extent we can, consequences that are things that we wouldn't want to see end up happening.
And I will be a bad moderator, so to share, given that, so don't anybody ask the question to Nicola, because I'll answer it. So let that be a lesson to you. But two things on on sort of the three lessons. What's really striking for crisis action, and we're distinct in this way, we were explicitly created for collaboration to be our day job. So the powerful thing for us is that we're not in competition with those that we're working with, we're actually serving them. And so it is how, by working with crisis action, do our partners have more impact than they would alone. And I would offer to you, there is power in that model, that collaboration of the kind. You listen to Angela talk about being the neutral broker. You listen to the work that Rocco and Rebecca are doing, are trying to figure out what is the catalytic intervention. You look at the work that Drew has been doing, actually, of surfacing that data and getting it in the right place. That is full-time work in and of itself. And fostering the collaboration that needs to bring together the diverse players that can really unlock change is a full-time day job. And so I would encourage you all to look at that handbook and to think about that as one key piece. A second, and to your point, Sasha, about, again, I think what you hear and for all of us is the process of disrupting the system, the solution you pursue is always better informed and more likely by listening to those that are affected by it. So with the refugee communities that you are speaking with, of what is it they actually need in their own lives. And in some cases, it will be the implementation of the regulations or the laws that have been put in place. And in other places, it is actually about that day-to-day support of what is it that you need to figure out how your kids get educated or how you start to learn to rebuild some livelihood from where you've had to flee your home. And then I think the other piece is about this collaboration of listen and lead. So we are, as Crisis Action, and it's one of the reasons why I have the honour to serve this organisation. The model is great, the purpose is mine of my life. But the team are also high impact, low ego. It is that sense of what you do is you serve. And that, I think, that culture piece, and it's written through our culture, and I think that's true. In the amazing session this morning, looking at 2020 foresight, I mean, listening to Tiana talk about culture, I think that's hugely important. The organisations, we've got the opportunity to create mini worlds in how we work. But on this point about losers, Andrea, I mean, one of the most painful things, you heard me say, Crisis Action has 5 criteria about deciding where we work, right? So we're 50 people in 12 locations. Look at the conflicts that we work on. Right now, it's Ethiopia, it's Yemen, it's Syria, it's Ukraine. There is another 15, 20 countries potentially where conflict is there, where partners are saying to us, Crisis Action, we need your help. And we have criteria to decide where we engage. And that is where we think there's clarity about what could be done. Is there a critical mass of partners to work with? Is there a prospect for impact? 4th, added value. If somebody else is doing this, we're not there. And 5th is capacity. And I say to the team, don't let capacity to be your key question. Like, if the strategy, all the other 4 answers are great, we've got to be able to find the resources to make this happen. But the reality is we have to choose places where we don't go. That's the emotionally brutal bit. And we choose places where we exit. As we speak, we are in Crisis Action speak, exiting Yemen. We've worked on Yemen for 4 years. We've worked with inspirational, breathtaking, humbling people. It's why I do what I do, because in the midst of human beings doing the worst to each other, my goodness, do we find human beings at our best. And it's partly Drew's answer, is partly that sense of be clear about why you're there in the first place. Be clear in your communication, that the choices that you're making. We aim to leave civil society stronger wherever we've worked than where we have been before, because we have fostered habits of collaboration, that ecosystem that we talk about. It's why one of the ways where we're a field catalyst or a system orchestrator. It doesn't solve the problem that my colleagues in Myanmar, my partners, the people I have the privilege to work with and serve in Myanmar and Yemen, are bereft in some ways when Crisis Action leaves. I said to the team, you're feeling grief. You're feeling grief. But actually there is that sense of we still have to choose, to make tough choices. That is the responsibility of those that fund us, of we will try and choose where we have most impact. It's why I think Skoll came to us to say that's what's entrepreneurial, which is you choose where to shift resources around, because they're not infinite, they are finite. The inspiration of this room and this forum is infinite, but actually our resources are finite. So I think it is about those tough choices, and it is about mitigating the negative risks. But I think you're right to say there is a better, that there's a finite, in any sense, that we have to make choices, and it's about the wisdom of the choices that we make. I will try not to abuse the floor again.
Nicola,
Yeah, Angela.
You said something about culture in an organization. I want to talk about mindset of you as a system orchestrator and field catalyst. And this is a humble submission I give to people in this room. I know this is counterintuitive because I am Kenyan, but in system orchestration and field catalyst, for me, my perception and what I'm offering to this room is you cannot think like a marathon runner. It's not about running the longest or the hardest so that you're the only one who stands on the podium and holds the trophy. And I'm quoting Caroline, a friend of mine, on this. Being a field catalyst is thinking about it like a relay race, right? I have a baton. I have my leg to run in this system. I will run my leg the best I know how to. And I will have an output, which is the baton, which will then become the input of the next person who is part of this system to do what they're doing. But at the end of the day, the race that we will run will be beneficial for everyone, not just us who run the race, but also the audience who are the end users. But I can't be thinking that it's about me running, and so that I can be on that podium holding that medal, wearing that, holding the trophy and wearing the medal as well. So, and for me, I've had to consistently make sure that I'm having my mind there, because to what you're saying, Nicola, the resources are limited, even within your own organization. And so to make the decision that I will make this decision that is not just going to benefit my own organization, but it might actually in the short term be a detriment to my organization, but because of the big picture that we are working on, I will take the short-term loss so that there's a long-term gain, not just for me, but for us. Because the sum of all of us is much greater than each of us trying to do something. Yeah.
And can we have the microphone over here and in the middle here? Thank you.
Hi, my name's Joshin Raghubar. I'm from an organization called UVU Africa, and I've realized today that's what we do. We are system orchestrators, so thank you for the language. Now I know how to communicate that, which is important because it segues from your comment around resources are finite. And, so it's quite easy for us to get up, not easy, I mean, nothing's easy, but it's easier for us to fund program-specific interventions. So when we listen, we triangulate, and then propose, we can land funding for our proposed catalytic interventions. And I think what Rocco talked about is, well, where's the funding for the system orchestrators? And how do we land that as a valuable good in its own, and how do we land it, and with who? So, I mean, you talked about philanthropic sources of capital, but what other sources are there? In our organization, we launch these catalytic interventions. We run them like social enterprises. We have a P&L, and we eke out a small margin because it's a nonprofit, and we turn that margin into running our systems orchestration work at the center, and then reinvesting it in our next intervention, which has been good for us, but it's hard and long. Where we could probably 10x our work if we had unrestricted multi-year philanthropic capital. Sounds amazing to us. But what are the ways to land system orchestration as something that is valuable and should be funded, and who do we land that with? That's my question.
I'm going to invite colleagues in the room who are funders to answer that question from Joshua. So if anybody would like to have a crack at that. But for this moment, Hilary.
Hi, everybody, and thank you so much for this discussion. My name is Hilary Abel. I'm the co-founder of a group called Project Equity in the United States, and we're working to scale employee ownership as a way to reverse income and wealth inequality, and working with public, private, and nonprofit actors trying to build that ecosystem. And I'm curious, I'm going to hone in on the term system and the term orchestrator and ask if you could share some additional thoughts on maybe what I imagine is a tension, what we find in our work is a tension between orchestrating. My brother's an orchestra conductor, and I think of the role of a conductor, all of the diversity of players you have in an orchestra, and the conductor has a strong leadership role and often wields his power, I'll say him because it's my brother, his power to make decisions on behalf of the whole orchestra. And I've heard all of you talk about certain partnerships and talk about these broader systems you're working in, and love, if we want to have exponential change, we need to be willing to cede control. I think it was Angela who said that, and Nicola, your notion of listening and leading. But say more about how you lead and the tension between, are there times when you need to or you have chosen to bring more leadership and actually exercise the power of your leadership and either bring strong proposals or make certain decisions on behalf of the broader system? How do you deal with that tension of sort of controlling and trying to orchestrate more a fine-tuned strategy versus ceding to all of the collaboration and the partnerships?
Thanks, Hilary. And a question. Thank you.
Thank you. Mine is actually a comment because I really appreciate this conversation. Something that I think, though, I would like us to speak a little bit more about is the resistance to systems change. And it's not only within the system. It's like the system fight back, and those who design the system fight back. And when they fight, we feel it, especially in different spaces. When I think about system, I think about, just our bodies. And when we think about catalyzing change, it's also about the conditions in which those systems thrive, or where the change in the system actually is possible. Is same with catalyzing. You cannot have a catalyzer between two chemicals in the wrong environment. And I'm just saying this because I love hearing all these initiatives. And one of those conditions is democracy. One of these conditions, even in crisis, there are conditions that allow you, if you are an international and a third person, like not involving the conflict, you have better conditions to actually intervene and trying to like change and steer the system there. If you are a local, or by any chance you're seeing part of the situation, you're targeted. I'm Nicaraguan. My country's living in a dictatorship. And all the system change that we led with civil society, it was shut in 1 year. So I just wanted to highlight that piece, because let's not forget that even though when we have the best of intentions, we're the savviest and we're like super excited and motivated and we have like the best leadership, we also had to be ready to fight that fight against the response.
Thank you so much for that comment. And I think that I started work in the wake of the Rwandan genocide, and we watched and managed to get agreement on this principle that has existed for 500 years of sovereignty. You get to do whatever you like in your own territory. And actually this notion of sovereignty brings responsibility. And what we're watching right now is we're watching that pushback of the sovereign first governments that say we can do whatever we like inside our country, a battle we thought we'd got to a tipping point, and how wrong we were. And so again, and of course, I was thinking we're in this country, I was thinking we're in America, but of course we know, with abortion, and again, a battle we thought with Roe versus Wade that we had won, and actually again, wanting to have to go back again. So I think that sense of tenacity and in the face of staying smart and savvy and collaborative is there. We are getting very close to time, so I would like to invite, if there are any funders in the room, on this question about what is the answer to Joshua's question about what those of us that are doing this work, what do we need to do better or different in order to make the case or to be worthy of investment to achieve change at scale? Is there anybody who wants to be brave enough to take that on and offer a view? Go for it, Liz. I knew I liked you.
I've got a very loud voice.
And then I'll give you all a chance to do the final. Just because of the live stream.
Sorry.
Well done.
The reason the Menzies Foundation, which is a tiny foundation from Australia, is involved in the bridge span work around this piece is because we think we need a new case to argue from about how philanthropy might evolve in terms of the way it thinks about supporting this work. I think also what's required is a new sense of partnership between philanthropy and those working around systems change that acknowledges the competitive nature of the way the system's currently structured to create competition rather than actually platforms for collaboration. And that sees or that encourages or expects or requires philanthropy to sit as a partner at the change table rather than as an entity that you report out to. Because for the life of me in any systems work that I'm involved in, unless as the funder I deeply understand, I sit at the table in co-designing the strategy and in going on the journey, it becomes impossible for me to have any understanding of what's required to fund those things, the places in between. The other thing that, if I can be bold enough to say, Nicola, that I'm really interested in this conversation is all three of these examples talk about working with government as the place to think about systems change. But I think there's another lens that I'm finding in my work that's deeply interesting and that opens up new forms of coalescence, and that is to apply an innovation framework around how we think about what the levers for change are and where we might unlock innovation. working with governments creates, I think, in many cases, a much more narrow conceptualisation of what change might be possible. It's often incremental. It's subject to different government dispositions to be open to change. It's impacted by electoral cycles. Yeah. And yet the most interesting, just by very quickly, an example of the work that we're doing, for instance, around school leadership, I spent 10 months doing due diligence talking about how to change school leadership in the Australian context, and no one would talk to me until I realised I was talking about talent pipeline, not school leadership. I could have gone to endless governments and had endless conversations about the same leadership development programs that currently exist. There are 1,500 of them. None of them are making any difference in school leadership. They're all an incremental response by government because it knows how to fund those programs. Instead, the Menzies Foundation has fostered a multi-sector collaboration, bringing the best of corporate thinking with school leaders and the best education researchers in our country together. We're just about to sign an equity deal with a Silicon Valley startup where the foundations, through grants, has funded a vertical in that startup around deepening collaborative capacity, and will now invest as an equity partner in how we launch that model globally. So I just think in these conversations we need to talk about innovation as well, how you find it, how you unlock it, where it exists. It's often at the periphery of actually the main game where the most exciting opportunities happen, and encouraging people to work differently, collaboratively, in different ways where you struggle around speaking the same language or working outside of your expertise or having to be humble in terms of what you build to co-create new solutions might also be another way of thinking about this work.
Thank you so very much. And as you can see, my fellow panellists, we are at time. I think actually Liz's words, thank you for that contribution, but I do want to just offer just a moment. Is there a final remark before I just thank you profoundly?
I'll just say one thing, which is, one of our key learnings, and I'll just say I think this is super painful, is that in our experience, the work of changing systems is actually not as hard as raising money to change systems. And it feels like that just cannot be the right answer. And I mean, my favorite single part of the Bridgespan Skoll report is that the average budget of a systems change organization is $5 million. For exponential impact, and just the recognition that that this is not just about changing what we fund, but changing how we think about what we fund, and the need to really look carefully at how we deploy capital for ultimate impact.
So colleagues, thank you so much for being in this room with us. Rocco, Rebecca, Drew, Angela, thank you for the privilege of sharing this platform with you. I think thank you, Liz, for your contribution, that invitation to forms of collaboration. If you want to do it, let's be smart, let's be savvy, let's be collaborative. And let's go back again to these disparate things that actually connect us around health, around changing or protecting our climate through the choices we make on transport, through protecting civilians from conflict. These systems, they are complex, they are multifaceted, but actually change really is possible. And each one of us, I think, I speak for the five of us, that we have the privilege of doing what we're doing, even in the challenge to search for resources, because what we are able to achieve alongside others is frankly awe-inspiring. It is awe-inspiring. And in this room, what we are collectively able to do, let's get smarter, let's get savvier, let's get more collaborative, and really focus on making those wise choices about where we can have impact. Thank you all very much indeed.
Thank you.